We broadcasted one earlier. The other one before that was a plasma rhizotomy. And this patient is having back pain coming from 2 discs, I believe, based on his clinical presentation, exam, and based on the MRI scan that I've seen. One of them is worse than the other. And of note, there is another disc in his sacrum. We call it an S1, S2 pseudo disc. I'm going to show it to you in a few minutes, and you'll see what I'm talking about. You want to switch over to the lateral view, Henry? Can you see the x-ray?
Yes, we see it.
All right. Show them first the L5-S1 disc. That is correct. Show them the L5 vertebral body. L5, yep. And then the S1. Now, look below the S1. It looks like there's another disc there. And as a matter of fact, there is. But it's not a real mobile disc. There's no movement there because if behind the disc, where there's supposed to be a facet joint, show them the facet, there's no real facet joint there. It's actually a bridge of bone. So even though a disc did form between the S1 and S2 bone segments, there's no facet joints, and you have to have facet joints in the back of the spine to move. Facet joints are another common cause of back pain, and a lot of people don't understand that. We have patients from time to time when they get their disc fixed, and afterwards they have facet pain because we didn't fix their facets. And they may even get upset about it and not understand why are they having pain now from the facet joints. Well, the Deuk laser disc repair doesn't fix facet joints. All right, we're doing the left L5-S1 and the right L4-5. This is Dr. Deuk. We're going to get started, okay? Are you comfortable? I'm going to give you a little numbing medicine. Just lay still. If you're having any pain, say ouch, and I'll give you more medicine, okay? You're going to feel a little discomfort right now. That's just the numbing medicine going in. Our patient has 2 herniated discs, L4-5 and L5-S1. The L4-5 is almost completely normal looking, but there is a tear, and he's traveled pretty far to come here. Doesn't want to have to come back again. So he wanted to get both discs fixed. And that's what we're going to try to do today. All right, so the first thing we're going to do is navigate down to the spine, specifically the L5-S1 disc on the left side. Shot. Let's get that wire out of the way. And what's that? How's he doing? That's nice. Really nice right there. He's a pretty tall guy. I can feel his facet. Beautiful. Are you comfy? Don't move, lay still. Shot. All right. Are you comfy? Is he reliable? If he's not, I can start on L4-5. All right, are you having any pain right now? All right, you can see the pedicle is pretty short there. I think we're off on orbit by a little bit. You see how there's a double shadow of the S1, anterior part of the S1 superior facet? Give me just a little degree of orbit. Maybe worse. That's a little better, yeah, for sure. It's not bad at all. That's not bad at all. All right, that's really good right there. All right, so Jordan, show our audience the tip of the needle and the superior facet of S1. Yep, there's the tip of the needle and there's the S1 facet. Good job, Jordan. Jordan has become quite the master of radiology. Are you comfy, sir? Yeah. All right. Shot. Yep. Shot. Give me, don't move. Give me a shot and then an AP. Perfect. So we're getting close to the back of the disc. Lay still, okay? Everything's going very well. You might feel a little discomfort from time to time. Just say ouch, and I'll give you some more medicine. Now our patient is not asleep yet. Ah, look at that. Stay there. He has got spina bifida occulta. You guys see that? I'll show it to you. Jordan, show them the spina bifida. There it is, right there. So this is the L5 lamina, and instead of a spinous process being there, the bones never fused together. He was born that way, and that may be contributing to why he's had back pain. He has an abnormality of segmentation and basically the dorsal fusion of the spine. He's probably gone his whole life without knowing it. Are you comfy? All right. Sean? There we are. We'll enter L5-S1. Where do you feel that? In your back? Huh? Okay, yeah, that's referred pain. You're doing great, by the way. Just lay still. We're going to be putting you to sleep before you even know it. Shot? All right, so we've done the L5-S1. Now we're going to access L4-5 from the right side. Everyone agree? Okay. Need to be a little bit lower. Shot? All right, very nice. Aiming for the facet. Shot? Any questions from our audience?
No current questions.
Let's go ahead and show our audience, why do people get back pain when they actually have a herniated disc? It's kind of interesting. Shot? It's all due to inflammation.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. Now that you've watched our video, you can see that back pain most commonly comes from what's called a disc. And discs are normally found in the spine, and they're cushions between your bones. So whenever you're standing up, you're putting a lot of weight on your spine, and that weight or force is transmitted from bone to bone through the disc. And this gentleman has had back pain for 8 years. And when I asked him, where is your back pain? He said it's right in this area here. Well, when I looked at his MRI, I saw there was not one, but 2 discs that were damaged. The top one was minimally damaged with a small tear, and the bottom one was damaged and degenerating. So it was collapsing down. So this one is far more advanced. That's the L5-S1. And the L4-5 is the other disc. Okay? Are you comfy? All right, just lay still, okay? You're doing great. We're going to put you to sleep in just a few minutes. How bad is that on a scale of 1 to 10? 8? Is that where you typically get your back pain? 8 over 10, and that's concordant. All right, has it gotten better? Is it better? Doesn't hurt? No. All right. That was your bottom disc, by the way. Anything there? What do you feel on a scale of 1 to 10? I can't hear him. 7. Is that where you typically get back pain?
Yeah.
All right. So that one there is not as bad as the one below. Jordan, show our audience the L5-S1 huge tear. We're going to put you to sleep. When you wake up, that pain will be gone. There it is. Show them the tear. Yep. And you can see the black stuff is the dye leaking out through the tear. So it gives you an idea of just how big the tear really is. Huge. So this was a 7 out of 10, and it was concordant, meaning it's his typical pain. All right, we're going to put you to sleep. Can you count from 1 to 100, please? Out loud. Now he's from Kansas City. So I like you to count in French. Can you count in French? All right, he's laughing at me right now, I'm sure. Good? All right. So he's already asleep. We're ready to get started. We have, as you can see, we have placed a guide wire through the needle. You good? Can I proceed?
Yes.
All right. And being from Kansas, you can clearly see that he's clearly a good American. He's got the colors of the American flag right there. Huh? Missouri. All right. Missouri. Sorry. We got some misinformation, I guess. But isn't Kansas City in Missouri?
But he's in a different city.
All right, he's not in Kansas City. He's close by.
Yeah, it does.
You know, I almost ended up in Missouri, working permanently. Like when I got out of residency, Olathe. They were looking for a neurosurgeon. Huh? No, it's a place called Olathe. It's like 30 minutes south of, I think it's south of Kansas City. And I almost took the job there, but they were kind of playing games with the call. Yeah, they told me it was one night of call every 3 nights. And then when I got there, they said every night. I'm like, well, it's a little different, you know. And I had been on call every night for the VA for years, and I didn't really want to be on call every night. So I said, no thanks. Anyway, here we are. And I'm really hoping this is going to help this gentleman get better. I expect it to. Here you go. So we know that he's got pretty big tear at L5-S1 and a pretty good sized herniation there. This is a little bit more painful. He rated it as an 8 out of 10. The other disc is a 7 out of 10. So we need to fix both. We're going to do this one first. Shot. Alrighty. Let's go ahead and come out with the dilator. Shot. Okay, we're inside the disc, which is good. And we're going to go ahead and do his surgery. Now you can see the amount of blood loss we've had here. It's probably a total of around 10 drops of blood. It's virtually nothing. It's half of a milliliter. 1 milliliter is 20 drops. So, you know, with open spine surgery, you're going to end up bleeding about 100 times more. Actually, not 100 times more. About 500 times more for this kind of surgery. If you were to do an open surgery, like a fusion, laminectomy and fusion. Now, why does a microdiscectomy itself not work? Microdiscectomy is a surgery that's done to unpinch the nerve going down your leg. And we call that radiculopathy, when the nerve going down your leg is pinched. It's not working right. But this patient's problem isn't radiculopathy, it's back pain. And so to get rid of back pain, you have to do something different than a microdiscectomy or a laminectomy. You see that pink stuff right there? That's inflamed annulus. That's what we're here to remove. Get rid of that in the back of the disc and you get rid of the pain. So we're going to use a laser because the grabber doesn't work too well. The laser is a much better tool. Very precise.
You ready?
We've been using the laser here 16 years. This same laser for 16 years. All right. Thank you. You can see the tear right here. And this is that big tear that we saw on the discogram. Any questions from our audience?
No current questions.
Okay, great. So while we're waiting for questions to come in, let's go ahead and show our audience just what does the Deuk laser disc repair actually do.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. And we are at the L5-S1 disc. We're approaching it from the patient's left. And the reason we're doing that is he's got really two discs that are damaged, and they're both causing his pain. The L5-S1 this is all scar tissue from chronic inflammation right here. So I need to get rid of this inflammatory tissue. I need to get rid of the herniation here that's stuck in the wall of the disc. By doing so, it should get rid of his discogenic back pain. We just did a test that confirmed his back pain is indeed coming from the disc. Now, does he have other sources of back pain? He could. Most patients have just the discs as the source, but about 20% of our patients, when they have surgery, they have also facet joints or SI joints or piriformis as a source of back pain. And we have to treat those other sources as well. Okay. So everybody's a little different in the sense that they have a little bit different composition of what causes their back pain, but I can tell you the most common disc in the lower back to cause back pain is the L4-5. L4-5. That's our next disc that we're going to work on. Now he has an unusual spine, as we just pointed out with the x-ray. This disc we're operating on right now really normally would be considered the L4-5 disc, but because he has a pseudo disc or a false disc in his back, and because he has a spina bifida occulta, which we saw on his x-ray, this really is, could have been his L4-5 disc at one point. Where are we getting white lines on our video? You think it's the camera?
Yeah, I think it's camera. What's happening?
Not the receiver?
No. By the way, we have 3 of those.
All right, yeah, I figured, but I think we should get one more.
One more? Okay.
Oh, yeah.
No problem.
You know? The problem is that if they go down and we're busy, we're going to wish we had another one.
No problem, sir. Yes, sir.
Yeah. All right, let me just see here. Little vein right there, tiny, tiny vein, but it's misbehaving. Now some people want to know, where is the nerve root? The nerve root is at the 3 o'clock position on this particular disc. Of course, 3 o'clock would be to my right in this area over here, and it's going to be just outside of that metal cylinder. We call it a tubular retractor. Tubular retractors are typically used in spine for minimally invasive type procedures like we're doing today. Any questions from our audience?
No current questions.
A quiet group today. Just as well. So what other options would this patient have for surgery to fix his back pain? Well, if done properly, an artificial disc could work, but the problem with them is you have to go through the belly to get to them. And going through the belly is a very dangerous path to get to the disc. Another option would be a fusion. And fusions are far more invasive type procedures. They're much longer recovery. And a lot of patients don't want to undergo fusion. They want to keep that as a last resort. Let's stop the laser for a moment. Let me get the grabber. I'm going to take a better look at what's going on. You can see there's a lot of degeneration going on here in this here disc. There's some epidural fat there, and we're doing a good job. Whoa. Why did you do that? All right, no harm, no foul. All right, very good. You had me worried that the light burned out or something. I think I heard Luis's heart skip a beat or two there.
Oh my goodness. Oh yeah. Honestly.
So 20% of our patients end up having some back pain even after the surgery, but it's not coming from the discs anymore. It's actually coming from something else like the facet joints, piriformis muscle. Those are the most common that we see, facet and piriformis. And they just need to be addressed. The good news is, with those kind of problems, they don't require surgery. I always tell people it's like taking your car in because your battery is dead. You need a new battery, but you may also need a new starter. We don't know that until we replace the battery, and then we see what's going on. And some people need both the battery and the starter switch replaced. Okay. So let's show our audience what a fusion surgery looks like compared to the Deuk laser disc repair. Let's have the grabber.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Well, I hope you enjoyed our comparison video showing you a fusion versus a Deuk laser disc repair. And I was just talking to Dr. Berndays about Punta Gorda, and I reminded me of a Club Med they had out there for years. I don't know if it's still there or not, but it was Club Med was my inspiration, one of my inspirations to become a doctor. Because if you were a doctor and you went to work at Club Med, you got to stay for free. Of course, you have to sign on for a year, but they didn't pay you either, so you basically work for food, room and board, I guess they say, right? All right. Anyway, we are getting close to being done at L5-S1, and what I can tell you is that because of his particular anatomy, his facet joint has been pushing me laterally away from the tear and the herniation, but what I did was I started laterally and I worked my way more medial. Medial means towards the midline, and that seems to be working okay. Any questions from our audience about the surgery so far?
No current questions.
All right. Yeah, it's a good idea. You can see the tear. We've cleaned most of it out. Just a little bit left now. We're going to be done in a few minutes with this disc. And then we're going to move on to the next disc. Now, the next disc is L4-5. Remember, we're not counting the pseudo disc or fake disc at the bottom. We're not counting that. We're calling that an S1, S2 pseudo disc. So some people would call this one the L4-5 and the next one the L3-4. But the most important thing is that you just operate on the right disc. So whatever nomenclature you choose, whatever labeling and assignment of disc numbers you choose, just make sure you get the right ones. And that's what we're doing. And I'm just about done here. We're going to move on to the other side of the patient. Now, the L4-5 we tested as well, definitely causing pain. What's interesting is this particular tear is very close to the end plate, the S1 end plate. It's more towards the bottom of the annulus than the top. And Just about done here. Pretty happy with the way it turned out. It's a pretty big tear to begin with, and there's a lot of scar tissue within this tear. You can see the white stuff, very thick, collagenized we call it. It's full of scar tissue or collagen. All right, I think that's good.
Sarah.
Let's take one more look.
No, no, 1 second. Are we almost up?
That looks good. Yep, that looks good. See if there's any more fragments. There's one. Like I said, this is a pretty big tear. You could see that on the discogram, and that's one of the reasons we do the discogram, by the way.
What?
Wipe it. Is to be able to see what kind of tear we're really dealing with. Because the MRI doesn't really show you everything. The discogram is much better at looking at the annular tear, which is actually the part we're here to fix. So it's really the best test, but laser, please. You don't want to be doing discograms on people left and right. They are invasive procedures, and they do come with some risk. We don't usually do diagnostic discograms without actually planning to do surgery. But we reserve discograms for patients that are going to have surgery to get fixed. All right, I'm pretty happy with that.
Good?
Yep.
All right. Lights on now, please. Thank you. No, no, only this.
So now that we've cleaned out the herniation, the tear will heal on its own. You can see little pieces of herniation everywhere here. You see those? Did you see them, Henry?
Yeah, we saw.
So that's why it's called an annular debridement, and there's really no other surgery in the world quite like it, because nobody else does an annular debridement but us.
That's what is missing your.
Huh?
That's what's missing your shoes. I'm sorry. That is what I'm missing your shoes every time you.
Oh, it does?
Yeah, yeah.
That's all right. But I block it from
Okay. good.
squirting.
Gotcha.
You see that?
Right
I
there.
always put my hand behind it. All right, a little medicine, and we're done with the L5-S1 left approach. We're going to put a little pressure on the muscle, because sometimes you'll get a little vein in there that wants to bleed a little bit, so if you put some pressure, you can stop it. The nice things about veins is, since the pressure inside the vein is 10 millimeters of mercury, you just have to put 10 millimeters of mercury or more, like 11 or 12, and you can stop the bleeding. If you have an artery that's bleeding at 120 millimeters of mercury, you got to put 120 millimeters of mercury pressure. All right. Are we switching sides? Okay, watch out. Please don't get too close. All right, Luis is going to come to my side. I'm going to switch with him, and I'm going to go to the other side because that's where I have to be to do this surgery. Any questions from our audience about the surgery so far?
No current questions, but we do have a comment from a Daniel 1970M on YouTube.
Hi, Daniel.
And they said, I recently found Dr. Chol W. Kim, spine surgeon on YouTube. He performs laser endoscopic surgery as well. I enjoy watching both of you.
Oh, good. That's wonderful to know. I know Dr. Chol Kim. Huh? You want some more num num? Yeah, of course. Yeah. Well, good. I mean, you know, we're here to educate you. I'm here to fix the patient, obviously, but if I can teach people a little more about the spine while I'm doing that, well, that's a good thing. So, me, I'm kind of a multitasker. It sounds like Dr. Kim may be as well. We've been broadcasting and showing our surgeries for almost 10 years now. Live from beginning to end, unedited for 10 years. Shot? All right, remember this particular disc does not have as big of a tear, but it is a painful disc, so we need to go in and repair the tear that is there. He actually has a small tear at L4-5, but I could feel it when I put the needle in earlier. I could feel the needle go through the tear, and I knew we had a problem. Now it's partially healed, but it hasn't completely healed. And the reason it hasn't healed is because there's still some jelly or nucleus pulposus in there. We're going to go and clean that out. Shot? All right, perfect. So this should be a quickie, 10 minutes back, maybe, and then we'll be done. If you have questions, folks, feel free to type them up in the dialog box, whether you're on YouTube or Facebook or Twitter or LinkedIn. I don't think we get many questions from our LinkedIn group, do we?
We do not, but the comment section is open.
Yeah, thank you. And for those of you that are interested, Deuk Spine offers an app for your phone or your desktop that is free, and it's got really good information in it about spine conditions and what can be done about them. Oh yeah, look at that. See the blue stuff? That's degenerated disc. You don't get that normally. You don't see any blue normally in a normal disc. So the fact that it's here, it's very spongy, and I can feel the tear right there. So it's a good thing we did this one. Yep. Anytime you see the blue dye staining tissue, it means that that tissue is abnormal. And it's the source of the inflammation. There's the tear right there. Look at that. Pretty cool. Of course, when we broadcast our surgeries, we keep the privacy of our patients respected and concealed. We don't give you their identity of who they are, but we tell you a little bit about their history. They have back pain for a certain number of years. We talked about this patient having back pain for, I think, 7 or 8 years. And his pain, like I said, was right here, right where we're operating at L4-5, L5-S1. And you can see why. He's got a tear and a bulge here. Now we would call this L4-5 a bulging disc because it's a what we call a contained herniation. So it's a grade 3 type tear, annular tear. And there's still scar tissue. You see all the scar tissue right there? I'm blasting it. That's scar tissue. And it's scar tissue that comes from inflammation. I can also tell the disc is under pressure, a lot of pressure from the inflammation. Remember, inflammation brings swelling. So if you get a piece of wood stuck in your fingertip, it starts to get swollen and tender. Imagine having a big giant pimple in your disc, and it would just be so painful just to move, to bend, to twist, to do any kind of activities. And that pain is constantly there and always aggravated with movement. We call it mechanical back pain in the business. Mechanical because it's related to movement. Mechanical back pain comes from joints usually, but it could also be from a fracture of your bone. This patient doesn't have fractures. We made sure before we did surgery on his disc. Now, some patients, we can't really say 100% whether they have some other kind of back pain. Could be coming from another source, not just the disc. But in his case, I didn't see any facet pain. I didn't see any piriformis pain or sacroiliac joint pain, just disc pain. So I'm hoping this surgery is going to fix him once and for all. He won't need anything else done. But some people do need additional things treated depending on the other sources of pain they have. That's a continuation of the tear right there. That's why you got to know what you're doing. You got to look around. See the jelly right there stuck in the tear? That's where all the pain comes from. It's kind of like the old days. Remember the ant farms? Where you could look at the ant farm in the glass panes. You could see the ants' burrows. All the little channels and caves, passageways. That's what this herniation is. It's created a tear in the disc and a passageway for the jelly to escape, and that's right there. That's what we're looking at. This is the interposed nuclear material, the interposed herniation. And there is no way to fix this other than with the Deuk laser disc repair. The Deuk laser disc repair is the original surgery that we developed at Deuk Spine, that I developed and pioneered with my team. And we've been doing this particular surgery for 16 years. We were also the very first in the world to do an endoscopic fusion. And I just posted that video today from 12 years ago, where we did a transforaminal endoscopic Optimesh at the time. It's a bag that you put bone into, fusion. And I did it on a chef who worked for Disney and injured his back at work lifting something. So I'm going to tell you something. The radiologist would have missed this herniation. And the reason is MRIs are not sensitive enough to see all this detail, but the endoscope is. You don't miss anything with the endoscope. Geez, it's taken a little longer than I thought because it's worse than I thought, you know? But we're almost done. Another 3 minutes, doctor? 3 minutes? Okay? All right. Good. Yeah, it's just more herniation than I thought based on his discogram and based on his MRI. But this is all inflamed and needs to be cleaned out. All right, any questions from our audience?
No current questions.
One thing I can say about this, if you compare it to the last one and several of the other ones we've done in the past, this is a more recent kind of tear and herniation. I would age this one somewhere between 6 months to a year. So I think maybe this patient had a worsening of their symptoms perhaps 6 months to a year ago, if I had to guess. And it's probably related to the L4-5 disc rather than the L5-S1. He's had pain for 8 years, so definitely both discs were a problem, but this one here in particular more recently. The L5-S1 older injury. Were you going to say something? Uh-huh.
And that he kind of there was a moment where the horse was low and he was high and they kind of onto each other.
All right, so he had an injury not too long ago. That could account for this what we're seeing here. Breaking a horse, you said?
Yeah.
Interesting. Anybody know what breaking a horse means? I do. Have you ever broken a horse, Luis?
No. I don't know.
You know what breaking a horse means, right? You guys know what breaking a horse means? Taming, yeah. When you have a wild horse, it's never been saddled and then you want to ride it, you got to break it.
Did you ever see the movie Spirit?
I haven't seen Spirit.
So good.
I saw Black Beauty.
Yeah.
Luis, I'm going to have to send you back to Missouri for a while. Learn how to break horses. It's kind of like breaking a teenager, you know? When you put a saddle on your kid when they're misbehaving. I still haven't broken my teenagers. I'm still trying to figure that one out. Almost done. It's taken a little longer because look at this. This is definitely worse than I expected it to be, based on his MRI and discogram. But he's going to be very happy, I think, with these results. All right. Just about done. A little bit of tear there. I'm going to have to clean that up. Well, this one has definitely taken longer than the last one. It's a bit of a surprise, huh? You can see the tear right here on the blue stuff. Well, we're just about done, doctor. I'm right at the outside of the disc. Maybe one more minute.
Yeah, you did very well.
Yeah, a lot of scar tissue right here. You can see how the scar tissue just looks different. Gets that golden calcium stuff. Flecks of calcium in there, dystrophic calcification. It just looks different than a normal annulus or a normal nucleus. The laser just takes care of business. That's what I love about this laser. It's just so amazing. It eliminates the problem very quickly, very safely, and with a lot of sensitivity and specificity, accuracy, I should say. Precise and accurate. Done. Let me just look. Yep. So you can see how the tear was more on the bottom of the disc, and there's the top part, and of course the nerve root will be out. The nerve root will be out in the foramen. So I'm happy with that. That was an example of where the annular tear pulled right off the bone, rather than tearing in the middle. All right, little antiseptic. We have one more surgery after this. Why don't we run for our audience one more time? How do annular tears cause back pain? Can you run that video again? What causes lower back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back, and hopefully you've learned something from that video that shows why do herniated discs actually cause back pain. It really has to do with the inflammation within the tear in the back of the disc, posterior annular tear, and once the annulus tears and you get the jelly, the nucleus squeezing through the tear, so the nucleus breaks off and a piece of it will go into the tear and cause inflammation. And that's where the back pain comes from. That's what I discovered at Deuk Spine Institute many years ago. And that's why we do the Deuk laser disc repair. It's special. It's not done by anyone else. Sure, endoscopic surgery is done, but not Deuk laser disc repair. All right, go ahead and type up your questions for me, and I'll be happy to answer them for you. And we're going to show you one video that will show you the difference between the Deuk laser disc repair versus open surgery like fusion.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's half-inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
I'm Dr. R. Deuk Machen here at the Deuk Spine Institute with one of my patients who's traveled from North Carolina because he had some herniated discs in his lower back and he was having problems with the back. What kind of problems brought you to Deuk Spine Institute?
Dr. Deuk, it was severe pain that I had never experienced before, and pain that scared me so much that I thought it was going to change the way I lived. I've got a family and I'm active, and it literally scared me to death. And as I'm talking to you right now, the hair standing up on my neck, the pain that I was suffering and where I thought I was, I didn't think there was going to be an answer.
And you were pretty much bedridden. You couldn't get out of bed. I remember you showed up here in a wheelchair because any standing was causing sciatic type pain in your leg.
Yeah, there was no doubt. And that's not an over exaggeration where I could maybe get up, like stand for 15, 20 seconds so I could get to the bathroom to go urinate, for instance. But then when I got there, I had to lay on the floor so I could rest up a little bit so I could stand with pain to even be able to try to urinate. And this went on for 2.5 weeks. It was absolutely brutal. And there was no respite. Pain that I've had in the past, I could find some position where there was some respite from the pain, and there was nothing.
So your wife is a physician. Was she able to fix your back problem for you?
I wish. No, I mean, she consoled me. And in the town that we come from, we know a lot of folks. And to be absolutely honest, we just weren't getting a lot of help. And like I said, we know a lot of folks, and it was prolonged, and we were talking about pain management and all that, and that's just not for me. And like I said, I was scared to death.
The problem with pain management, unfortunately, is that it doesn't fix the issue when you have a herniated disc and back pain from a herniated disc, because you need surgery on that disc to repair it. That's what the Deuk laser disc repair did. And you can actually see here that we went into his disc with the endoscope and we were cleaning out the herniation with the laser. And the laser actually makes a huge difference. People say, oh, lasers, they're not used in spine surgery, but they are. And they're very, very powerful tools and very precise. So we were able to clean out your discs, remove the herniation. And how do you feel today?
I feel great. I mean, it's probably, I mean, I know I'm on camera right here, but I literally could not walk into the office yesterday. And I mean, you're gonna see my shorts and everything, you'll have to edit, whatever, but I'm able to walk.
That's awesome.
And I'm just, it wasn't even close. I was actually, and I don't know if you can tell from the camera that what my personality is, but I try to be very polite, and I was apologizing for profusely sweating because I hurt so bad. It's not because of the Florida heat by any means. It's because I hurt so bad. I'd never experienced pain like that. And like I said, there's no
because you're a redneck too. You know, you're not that far from Florida.
That's
you're
right.
Just up a state or two, right?
That's right. Yeah.
A couple of states. So you're feeling better today. It's been less than 24 hours since we did your surgery. You went home an hour after the surgery, back to your hotel with your lovely family who I met. And how do they feel about your progress?
They're happy that I'm happy. You know what I mean? Because they were scared too. You know, now they were putting on a strong front, but I am just telling you, I was at my wit's end. And I certainly are a lot more appreciative of people who have pain that I'm aware of, because when there's no rest from it, oh my gosh, you know what I mean? I was really at my wit's end, and you saved me. So I appreciate you very much.
You are welcome, sir. Yeah. Is there anything else you want to say to your fans out there?
Thank you. Sorry, I could have prettied you up for you a little bit better. So just had surgery yesterday.
All right.
Cut me some slack.
Excellent. And you're heading back home today, correct?
Yeah, we're going back on the plane later this evening. The kids are going to swim a little bit down here in Melbourne. I am just going to rest and watch TV, but then we're going to get on a plane a little bit.
Awesome. Yeah. All right. Well, congratulations. You had faith.
Yes.
Took the leap and you got the surgery done.
Yes, sir.
All right. Awesome. Yeah. It's Dr. Deuk at the Deuk Spine Institute here in Florida with one of my patients who had the Deuk laser disc repair for a back injury, and it was around 6 to 8 weeks ago. And you're back for a checkup. How are you feeling today?
I feel wonderful. I feel great. I feel fantastic. I mean, this is the man. He's the man.
Well,
and I came in with a lot of pain. I couldn't believe it. And now I'm virtually pain-free. It's unbelievable.
How long did you have your back pain? How did that start?
Oh God, that happened many years ago at work, at least 20 plus years. And I had other surgeries in the past, and they really didn't help. And this last one, it just got so bad that I had to do something. So luckily, through the grace of God, I came here, and
amen.
Yeah, and I'm A1 now.
Awesome. So you had your surgery. You've been doing therapy. Would you say the pain you had in your back before surgery is still there, or is it gone?
Oh, it's gone. It's gone. I have little twinges now, but they're muscular, and that's, which is fine. That's going to go away over time. But my God, what a relief! I'm ready to get back out there and do all the things I used to do, man. It's kind of exciting. It's kind of fun.
Well, it's important that people understand too, when you have 20 years of chronic debilitating back pain, what happens is the muscles in your back shrivel up and atrophy because you're really not active anymore because it hurts too much. So, you know, we can fix the spine pain, but it's going to take time to rehabilitate the muscles and get them back to normal. So I'm glad we're touching on that. So what does your life look like now that we've gotten rid of your back and leg pain?
Well, yeah, I'm going to go back to what I've always done and what I've always enjoyed doing, which is my automotive hobby. And I'm really looking forward to being able to actually lift things again and getting the contorted angles that I used to get working under cars and stuff. It's just gonna be nice. Quality of life is it's
not too soon with any of that lifting engines
all right,
and contorting your body.
yeah, all right. but I have, all kidding aside, I have noticed over the years I developed a way to walk, almost a crab walk kind of thing, and I got used to it, and I got, well, that's the way it's going to be. I don't have that now. I mean, it took a little while because it was some pain trying to get the muscles to come back. But my God, you just stick with it. If you got to get it done, stick with it, because you're going to get better. You're going to get better.
Well, yeah. Congratulations. Is there anything you want to say to wrap things up to your audience?
He's the man. Come see this guy.
All right, congratulations.
Thank you, doctor.
You're
God
welcome,
bless.
sir. God bless you. All right, well, hopefully you enjoyed that video. What explains the difference between more traditional open back surgeries like a fusion, where we clean the painful disc out, and by cleaning the disc out, we put in a spacer, and that spacer takes the place of the disc because it keeps the bones separated. You can see the spacer there. You guys see that right there?
Perfect.
And basically, the problem with fusion is when you're putting screws and rods, you're stiffening the spine, you're not letting it bend and twist like it's supposed to, and that's going to end up limiting your movement, and it's permanent. You can't go back and undo that. Artificial discs, in my opinion, don't work well. They pop out, they fail. A lot of them end up fusing over the disc, so you know, putting the disc in is not very effective. There's no better way to get rid of your pain that comes from a bad disc than to fix the disc and get rid of the pain source. And that pain source is actually located in the back of the disc. That pain source is a small tear located in the back of the disc, and you guys can see the tear right here, and that allows the red jelly to push up through the tear and erupt like a volcano, spilling out the jelly through the tear. So what I did was I went in, passed and pushed this jelly back into the disc, ended up right about here at the base of the tear, and then I used a laser to clean the edges and remove the pieces of herniation, ending up at the outside when I was done. And that's why you could see the hole where the tear was and the jelly was used to be in that tear. By debriding the annular tear, which is what the Deuk laser disc repair really is, you're able to get rid of the source of pain by getting rid of the source of inflammation. And in time, the wall of the disc will mend itself with collagen and heal, and there won't be any more pain and there won't be any more herniation. So the procedure is called the Deuk laser disc repair. We're the first in the world to describe it, the first in the world to peer review and publish it. And it was peer reviewed and published in Surgical Neurology International about 10 years ago. All right, any questions from our audience?
No current questions, but we do have a comment from Rashonda Parham on YouTube. And I've seen she's seeking help or advice. She said, I have 3 bulging discs in my neck from an injury I sustained 6 months ago. I have a lot of swelling in my neck and can no longer hold my head upright due to this horrible shocking pain. I have had 4 rounds of steroids with no relief.
Okay, Shauna, thanks for commenting and sharing your story with us. You are experiencing a common problem. And the good news is this surgery can fix that. We can repair those discs with a laser. It's done with a small little incision on the front of your neck right here. If you go to our YouTube channel, that's YouTube, then type in Deuk Spine Institute, spelled D-E-U-K, Spine Institute. Go down to the cervical Deuk laser disc repair, cervical DLDR, Deuk laser disc repair, and you can actually watch a lot of our patients' testimonials that have had the same problem, and we've gone in and fixed them. I've never seen a bulging disc that we couldn't fix, unless of course the neck is too thick or the shoulders are too high and block access. But what I mean is, when you have pain coming from a herniated or bulging disc, it is a pain that can be eliminated through surgery, specifically through the Deuk laser disc repair, as long as you have the right anatomy of your neck where it's accessible. You can actually watch some of those surgeries on our YouTube channel. You can watch the entire surgery from beginning to end. We broadcast these every single week that we're operating. There are some weeks when I'm out and we're not broadcasting. I think next week we have 4 surgeries on Tuesday, 4 surgeries on Thursday. They're all laser surgery, Deuk laser disc repair. We've got, I think, all 4 on Tuesday are cervical. So that's next. If you want to join us next week on Tuesday, you can watch the Deuk laser disc repair surgery for herniated discs in the neck. We're doing 4 of them on that day. So it'll be a busy day. All right. Have a wonderful afternoon. I don't think there's any more questions. We do have one more surgery coming up. Our next patient is a nurse. She's coming from Alabama, and she has herniated disc at L4-5 and L5-S1. And her herniations are off to the left side. So when you have a herniation that's off to the side, like the left side, it can actually affect the nerve by pinching on the nerve root or irritating the nerve root. So I'm going to go in again from the side, going through that hole that's already there. And so if you want to look here at the spine, I come from the side like this, and I go past the facet straight into the herniation. There's no damage to any of the tissues in the back, not like fusion surgery like you just saw, where there's lots of scar tissue, bleeding, and damage. So the Deuk laser disc repair is minimally invasive endoscopic surgery, state-of-the-art, best surgery in the world for any kind of a disc problem, like a bulging disc, herniated disc, protruded disc, ruptured disc, extruded disc, degenerated disc. All that can be treated with the Deuk laser disc repair. We'll see you soon.